Good morning again, everyone, and let me again acknowledge Secretary Sinaviratne, of course, our chairman, Dr. Indika Waninakayake, our good friend, Mr. Yamada Tetsuya from JICA, and of course, also our good friend, Admiral Pereira, the head of the Presidential Task Force on Narcotics. Good morning, everyone, distinguished guests, ladies and gentlemen. It is a privilege to address you this morning at the Second International Symposium on Drug-Related Studies. Allow me to express my gratitude to the National Dangerous Drugs Control Board of Sri Lanka for hosting this significant event and for its steadfast leadership in addressing drug-related challenges. The Colombo Plan is honored to be a partner in this initiative, which exemplifies the power of joint efforts in combating the devastating effects of drug abuse. This symposium, under the theme Balanced Coordinated Strategy for Building a Drug-Free Community with Active Citizen Engagement, provides a vital platform to explore innovative, evidence-based solutions to one of society's most pressing challenges on drug prevention, control, and treatment. Building on the momentum of the inaugural symposium in 2022, we likewise share JICA's affirmation that this event is an opportunity to deepen, foster collaboration between local and international scholars, practitioners, policymakers, and showcase cutting-edge research and amplify the impact of strategies aimed at reducing both drug demand and supply. The Colombo Plan Drug Advisory Program, with its decades of experience in drug demand reduction, supply reduction, and prevention across many regions, firmly believe that knowledge sharing and evidence-based practices lie at the heart of meaningful progress. We have developed 120 universal curriculum courses, some available online, that deals with prevention, treatment, and recovery, and it concerns various settings. To cite as an example, the Colombo Plan has UTC courses number 52 and 53, which deals with community-based substance use disorder treatment outreach and implementation in rural settings, which is aligned with our theme for this year and is being implemented in over 80 countries worldwide. These courses clearly define evidence-based trauma-responsive environments for a more efficient implementation of intervention. It also expands on the standard principles of addiction treatment by providing a step-by-step information on operating facilities, treatment hubs, service centers, with emphasis on the role of family-centered care. Colombo Plan, just like our partner from INCB, also collects samples of actual seized substances from narcotics agencies all over the world. This is done together with the help of USDA. We actually identify unknown seizures. We test them using our laboratory partners based in the US. And based on the samples analyzed, we issue 5 to 8 alerts or advisories per year on new synthetic substances and adulterants being used by illegal drug manufacturers. This initiative is a proactive approach to get information on drug trends and the corresponding appropriate public health interventions needed to address mortality and morbidity from these emerging drug of choice. This coming 2025, we will be training laboratory personnel from 4 member countries, including, of course, Sri Lanka. And we will be hosting the NDDCB will be hosting the training here in Colombo. This will help us how to detect latest, this will teach the trainees how to use the latest testing equipments that will help us gather more information. And Colombo Plan, with funding from the US State Department, will also provide the equipment for the respective narcotics agencies of those 4 member countries. Our organization believes that evidence-based policymaking also encourages a virtuous cycle of knowledge building. By evaluating policies and programs and using program data, we can learn how well programs are working. We can use them. We can use the information and improve or terminate consistently ineffective programs and find better approaches. Sufficient to say, this year's symposium, diverse track spanning prevention, treatment, and policy development, serve as a roadmap and aligns with our objectives to address evolving challenges such as synthetic drugs and emerging patterns of substance abuse. Our collaboration with NDDCB, the diplomatic missions, of course with our partner international organizations, the UN, JICA, underscores the importance of partnership in addressing global challenges. By working hand in hand with international agencies and local stakeholders, we ensure that research findings translate into actionable policies and sustainable practices. To all the participants, I urge you to seize this opportunity and engage in meaningful discussions, share innovative ideas, and foster collaborations and transcend borders. The drug concern should transcend geopolitics. The collective efforts initiated here will ripple through communities, creating a brighter, drug-free future. In conclusion, I commend everyone here, especially the NDDCB and its partners, for their dedication in advancing this critical agenda. Let this symposium inspire us to strengthen our resolve and take decisive steps towards eradicating the drug epidemic. I wish you all the very best and a fruitful and productive symposium. Suba Oda Senap.